I'm Drew Helmer, and I'm here to speak about my personal experience with treating combat veterans in the Veterans Health Administration of the U.S. And I'm taking a slightly different approach. I don't have any slides, and I may actually catch us up a little bit on time. But I'm hoping to share my perspective as a physician, as somebody who has worked directly with patients and has seen our system, our complex system of addressing the needs of veterans from several different perspectives. I have 7 points. I can count to 7. The first one is war has health consequences. That may be obvious to all of us in the room. I don't think people actually know that in America. And I think it has a couple of different flavors. First of all, there are kind of the universal experiences of war. Doesn't matter if you were deployed to Vietnam or to Afghanistan. But there are also some conflict-specific health effects of wars, and I think it's very important to recognize those. It's actually been alluded to in this panel already. There are immediate effects of wars, and there are also things that happen later, whether it's because they're not recognized immediately or because they actually have a latent period and they don't actually manifest until later in life. That's point number one. The second point deals with how do you address these health effects of war? Expect them. They're not unexpected. And I think that's really important for us. I didn't serve in the military myself, but I think it's very important to normalize the experience for veterans who are transitioning out of military life, transitioning back from deployment, to say, these are some of the things you might expect. Don't paint a worst case scenario for them, but give them a little bit of warning and say, hey, you may have nightmares. Many people do, and we're here to help you when that happens. It's also, along those lines, you don't want to necessarily medicalize or pathologize, my apologies to the translators, that some of these things are normal experiences, and you don't need to see the doctor for them. Maybe you just need information. Maybe you need a lot of information and education and support. Along this line of the health effects of war, the effects of war on your health and well-being, it affects the whole person. And this has been extensively discussed on this panel and earlier panels. And it doesn't just affect the service member, it affects the family and the community as well. And so it's very important to take a holistic approach to this. What else can we do to make it easier? We need to lower the barriers to accessing information, good information. Some of the research, evidence-based information needs to be made very available and shared widely. But beyond information, which is what some people, all they need is information, other people need an assessment or consultation, and we need to make it easier for people to get that consultation. And then based on that, some people may actually need care, and very intense care. Our seriously injured service members coming back, you know, I think it was Dr. Castro who was alluding to the high quality care that our US service members get, truly state-of-the-art care for those who are seriously injured in combat. But everybody needs to be able to access the care that they need to help them through these challenges, to optimize their health and their well-being. It's also important from a systems and from a societal perspective to match the intensity of the care with the needs. We're doing an exercise with my organization right now. It's a value stream analysis, and it's kind of a consulting sort of analysis. And we're learning about gold plating and how you can always do more. I think our US healthcare system is very good at doing more. But you don't need to do more. You need to do what's right. You need to treat the problem as indicated with the right intensity and the right type of services. And I think that's my 5th point. I'm up to 5 now, in case you lost count. You need to take a team-based approach. I'm a general internist. I've kind of specialized in deployment-related health problems. I can't do it all by myself. I need my mental health colleagues. I need my social work colleagues. I need sometimes very specialized subspecialists, orthopedists, physiatrists. You know, we need a team of people. You need family members. Family members are critical members of the care team, and you really need to engage the whole team in order to meet the needs of some veterans. Almost second to the last point, These are very complex systems. I loved the map of the Ukrainian veterans benefits as it stands right now. Even with a single VA in America, we still have a plate of spaghetti in terms of the benefits. And it's very complex, and this was also alluded to earlier. The definition varies. I mean, how are you going to expect a veteran to know whether they're a veteran or not, according to the rules and according to the laws? And so you need some navigators to help you through that system, and I think a lot of our community partners are very good at helping veterans navigate the system. And I just wonder if, if we get a chance to discuss things today, the importance of peer navigators, people who have been there, people who have successfully, navigated the system, whether with the same conflict, the same geography, or whether with a previous conflict or previous geography. And finally, I thought this was a great parallel. We didn't plan this, did we? But the virtual technologies, I think, are really, really important. I think healthcare in general can tap into telemedicine, virtual technologies, to improve both access to care as well as cost effectiveness of care, and certainly there's a lot of research supporting that mental health care in particular can be delivered just as effectively through a telemedicine modality as it can in person. And so with that, I'm going to hand it over to our next panel member, and hopefully we'll get some discussion.